My name is Andrew Sykes. I'm an actuary, a behavioral specialist, and a former smoker. In the world today, we are suffering from what is the largest preventable disease on the planet, tobacco and smoking-related diseases. 1,300 people will die today, more than 10 by the time I'm finished speaking to you, from tobacco-related causes. That's 1 in 5 people. And for every one of those 5 people, there are 30 people suffering from COPD, cancer, stroke, heart disease, diabetes, and a range of other diseases. The human cost is devastating. The average smoker will lose 10 years of their life. But the economic cost at over $300 billion is difficult for employers and insurers. It's crippling for the patients that have to pay their share of the bills. And as an employer, not only do you fund the cost of tobacco-related disease, but if you employ someone who smokes throughout their entire employable life, they will spend 3 whole years outside smoking cigarettes, not working. That's before we consider the implications or costs of extra sick time, presenteeism, and health-related costs. Some people say the war on tobacco and smoking-related diseases has been won. We disagree. Many people say there are a plethora of available solutions to help people, and that's true. Almost everyone has access to a solution through their insurance company, free resources from mobile apps or on the internet or from social networks. But their success rates are terrible. There are a few pockets around the country where medication and coaching, live sessions together have brought about fantastic results in smoking cessation. But they're small pockets and they're inaccessible. The result, the average smoker today quits on their own, cold turkey. 19 times out of 20, they fail. The landscape is filled with highly accessible but ineffective solutions on the one hand, and these pockets of good, and in the case of the FTTC, fantastic programs that deliver reliably for people who are struggling. Those who have the biggest challenges with tobacco go to the FTTC. We exist to populate that part of the landscape where no one today exists. A highly accessible, fully functional, medical grade and effective mobile smoking solution and mobile app that we call Mo. Now, you may say that the 20% of people who still smoke today do so because they want to smoke. If they'd wanted to quit, they would have found resources, and that couldn't be less true. 2/3 of smokers today want to quit. A half of them have tried or tried again in just the last 12 months. And 1/3 of them are already willing to try a mobile app. And as mobile technology becomes ubiquitous, both locally and internationally, that percentage will only go up. And that defines our target market. We care to serve eventually the 1 billion plus smokers around the world. But we'll start with the subset of the 42 million people in America that still smoke, the half of them that care to quit, and the 1/3 of them who will attempt to do so using a mobile app in the next 12 months. What makes us think that we can succeed when everyone else has failed? We are bringing together the very best smoking cessation technology from the FTTC with a long track record of the highest success rates available today. But to take that to scale, we need a rich mobile app that's filled with effective behavior modification techniques and tools. The Behavioral Research Applied Technology Laboratory has a 4 powers model, a toolbox of over 80 highly effective influence methods. Things like game mechanics and social contagion. We're inviting people who are not smokers or former smokers to be part of the communities to support our primary targets. Indeed, we have packed this mobile application with more than 50 of BratLab's most effective influence techniques. Combined with that, we have a rich content around the use of medication, the impact of smoking, and everything else that a quitter needs to succeed. Aegis Creative is a content and solution provider to the pharmaceutical and biomedical industry, and they are bringing about all this content and, importantly, the business resources to bring Mach to life, and the leadership in our CEO of Dawn. Last but not least, my company, Health at Work Wellness Actuaries, builds products for health insurers, employers, brokers, and wellness companies. And we will lead the charge into those markets of taking this solution to market. Now let's learn some more about the genesis and the development of Mo.
Morning. My name is Paul Burnetta. I'm a pulmonologist, a co-founder of Mach, a co-founder of the Tobacco Education Center at UCSF, and most importantly, an ex-smoker. And I think that's really important because this is a difficult journey that I was able to conquer in my 20s, but it requires empathy and understanding and tools that are designed specifically for people that desire to quit. As we've heard, tobacco-related disease is an incredibly important public health issue, and it doesn't have adequate tools now to be successful. The FTTC was founded more than 15 years ago. It provides inpatient and outpatient services to the UCSF community. It largely provides group services, and immediately post-group, 70% of patients have been able to quit successfully, which is excellent. And that's sustained out to 40% at 12 months. But as you can see, when you lose engagement in the group, you lose success. And the benefit of an app is to maintain engagement over time. What we're doing is to really combine the best processes from FTTC and engage the influence techniques that the Bratt Lab provides. Thank you. If you look at currently available apps, in many ways they're two-dimensional. They're accounting process. They don't provide motivational content. They don't provide information on medications. What we're doing is to provide a clinical-grade app that's been clinically proven. And that's critically important because if you look at what's happening with the Affordable Care Act, with a focus on preventative services, if you go to your doctor, they're going to ask you if you quit. And to be a health professional, you have to have something that's clinically validated that enables you to recommend something. And that's the target audience beyond smokers that we have to engage: doctors, nurses, pharmacists, and dentists. And proving efficacy is a critical component to that. We've developed a clinical and technical development plan that accomplishes that. We've just been through third-party usability testing online. We're moving forward to doing a open-label outcomes assessment, and then want to confirm these benefits in a randomized controlled trial, and to do that in the most cost-efficient and rapid manner. And if you look at what we've done with our initial usability testing, this was an assessment of 40 people in the process of quitting. It was all done online with recruitment from Facebook and from Craigslist. It was a very well-received program that was conducted by the mHealth Impact Lab of the University of Colorado. There were very important, very specific suggestions that we took back. Clearly, privacy and security are critically important. Specific reminders to re-engage the process on a daily basis are critical. And having personal stories really maintains motivation, and that's what we intend to do through the development of this app. The most important issue is that there was a clear recommendation to develop all of the components of the app, and that's what we'll be taking forward as we do additional research. Great.
Good morning. I'm Dawn Ripola. I'm CEO and co-founder of Mach, and I want to talk a little bit about the team that's behind this. So you've heard Andrew and you've heard Paul, and they're clearly experts in their field. What we've done is we've also brought in a scientific advisory board that provides us expertise in the clinical and pharmacological aspects of the project. Now, I know you're all thinking, isn't there an app for that? And we've talked about that a little bit. So I'll say it out loud. Yeah, there's about 350 of them on the App Store right now. Like these gentlemen have pointed out, they're not clinically validated, they're one-dimensional, and they are not something that a clinician can actually recommend. So why is Mo different? As we talked about, it's a medical-grade app that has demonstrated efficacy and clinical relevance. We're working with the mHealth Impact Lab out of the Colorado School of Public Health to ensure that clinicians can actually recommend this and insurers can pay for it. So today, we're pursuing a business-to-business model. You can see that we've got 5 channels, market channels for Mo, and we're pursuing first the insurer and wellness community. And here's why we're doing that. Today, insurers spend about $1 per member per year to provide smoking cessation products for their members. At that cost, they're paying for about 5% efficacy. We are confident that we can achieve more than 30% efficacy, and I want to put this $1 per member per year number in perspective for you. That is about 1/100% of what an annual insurance premium is. So you can see that at scale, this can become a very profitable business. So just based on the U.S. market and on the 6% penetration rate into the total addressable market, by 2014 or 2019, we're anticipating having 11 insurers and 7 wellness companies as customers. I want to talk about barriers to entry for just a second. So in addition to kind of your typical IP clinical trial data, we think that our competitive advantage, one of the barriers to entry and one of our competitive advantages will be ongoing data acquisition and analysis. This allows us to really tailor to individuals so that they'll be more successful, but it also provides a very interesting data set that we think may become another stream of revenue. So why are we here today? We're requesting investment of $2 million, the first tranche of which would be $1 million. Uses of those funds would be to complete system development and conduct our second trial. And finally, I just want to remind you, we're Mach. We exist to win the war on tobacco-related disease, and Mo is just our first weapon. Thank you.